I am Dr. Pankaj Singhai, working as a consultant physician and head of the department internal medicine, Manipal Hospital, Bangalore. Tuberculosis is a very common infectious disease, especially in India and worldwide also. How to diagnose and treat it? Tuberculosis is an infection disease caused by Mycobacterium tuberculosis, which typically affect the lungs in 90% of cases, but also can affect other part of the body, that is lymph nodes, which causes tubercular lymphadenitis, brain, tubercular meningitis, abdominal, Cox's abdomen, and bone and spine tuberculosis, which is 10% of cases. Transmission, it is spread through the air when people who have an active tubercular infection by coughing, sneezing, which transmit the respiratory fluid through the air. Risk factors include alcoholism, HIV infection, long-standing diabetes. Diabetic patients, they have a 50% of chances of infection with tuberculosis. Classical symptoms of active tuberculosis are chronic cough with blood-tinged sputum, evening rise of temperature, night sweat, loss of appetite, loss of weight. Diagnosis on the basis of symptoms and signs. Active tuberculosis depends on clinical symptoms, signs lasting for more than 3 weeks, and laboratory tests include sputum for AFB, that is acid-fast bacilli, which is the tubercular bacterial infection. Montour's test to confirm, which is a supportive evidence of infection. Chest X-ray to find out the cavitary lesion or infiltrative lesion in the lung, which is typical in tuberculosis. TB PCR and gene expert test, which is a recent, very important, very specific and sensitive test. CT scan and MRI depending on type and site of the infection. Like tubercular infection in the spine, we have to do the MRI spine. Tubercular infection of the abdomen, we have to do sonography or CT scan of the abdomen. Treatment, anti-tubercular therapy, which includes isoniazid, rifampicin, ethambutol, pyrazinamide, streptomycin. Anti-tubercular drug should continue for at least for 6 months, and disease treatment can prolong for 9 to 12 months also, depending on the site and severity of the infection. In HIV patient, tuberculosis treatment should continue more than 18 months. And multi-drug resistant tuberculosis, depending on the progression of disease and improvement after the medication.